Hello and welcome. I'm Dr. Lewis Hassel, coming to you from the University of Oklahoma Health Sciences Center with a little bit of Chihuly glass here in the background, featured from the Oklahoma City Museum of Art. Our program is digital slide review and sign out. And I'd like to talk to you today about a somewhat unique case, but one which may become something that we see more frequently in the coming days. So the case is an elderly woman who has been treated with some anti-cancer agents, which include BRAF inhibitors. So she's 83 years old. She's otherwise healthy, but has had cholangiocarcinoma and now has been treated with some chemotherapy agents and some targeted therapies. So she now has abdominal pain, bloody diarrhea, and that is a hallmark of some potential serious problems. So let's just talk about what can cause diarrhea in an elderly patient. Of course, common things are common, so you do want to worry about infections, get the travel history, see if there's been exposures. She may have toxigenic bacteria, such as Clostridia. Those would be a possibility. Ischemia, certainly an elderly patient can develop ischemic colitis just due to underlying cardiovascular disease. And although it's unusual for inflammatory bowel disease to present in an elderly patient, it's not beyond the realm of possibilities. And so it's something you should think about. Medications, of course, polypharmacy is very common in these elderly patients. So things like NSAIDs, hormone replacement treatments, various anticoagulants, and other drugs can cause diarrhea and bloody stool. And then, of course, malignancy, stercal impaction due to constipation and other causes as well. So the patient that came to endoscopy, and here's the picture that we saw. As you can see, there's some modeling of the mucosa, and then you have this yellowish, slightly granular exudate in areas. Here, a little bit more confluent, but sort of a yellowish pus-like color. Just kind of looks very ugly. But notice that it's not totally circumferential, although some of the erythematous changes do appear to be nearly circumferential. So the endoscopist favored us with multiple biopsy sample fragments, and as you can see, we've got a fair amount of it that looks pretty unremarkable. A couple of these fragments look pretty good, but then right next door here, look, we've got inflammatory cells. We've got things dropping out. Sort of a coagulum, mucinous changes, and so forth. Then we see some mucinous changes on the surface. Here we see a little bit of a gradation with some atrophy of these crypts with some beginning erosion here. And then over here we have full-blown necrosis with fibrin and inflammatory exudate here, as you might see in a pseudomembrane or in ischemic type colitis changes. As we look around a little bit further, I think we can see a little bit more of some of the incipient changes. Here's a little bit more of these kind of withering crypts with mucin extravasation and reactive cell death and so forth here. So kind of looks a lot like a toxigenic infection or possibly ischemic colitis type changes. We do have this ulcerative exudate here. And then also note we have this increase in sort of surface mucin that's going along in some of these other areas as well. So without that history, I think, lacking that history and just bloody diarrhea, you might have just said, looks like ischemic colitis or possibly toxigenic related pseudomembranous type colitis. But with that history, it was significant to then look and see what percentage and what the possibilities were for this being related to a anti-cancer medication that she was receiving. So what kind of adverse events have been reported with these MEK and BRAF inhibitors? Well, fever, fatigue, nausea, these are relatively minor things. But in terms of serious diseases, bleeding, diarrhea, rash, and other more serious things can occur in a fair proportion of patients. In fact, BRAF-MEK inhibitor-related colitis have been described as ulcers with neutrophilic infiltrate, ischemic type changes with withering glands, and variable amounts of acute colitis with or without erosions. So I think in our situations, we're looking at ischemic type changes with withered glands of neutrophilic infiltrate and pseudomembrane formation, more serious type of process. Interestingly, I found this article from the Wiley Library being quite helpful to look at the other targeted therapies that may be imposed on some of these patients in terms of immunotherapy in contrast to the BRAF inhibitors. And notice that in some of these, the incidence is quite high of digestive events, although serious events, such as in our patient, usually in the 5% or less. And although the changes in BRAF are described as being right colon, in our patient it was in the left colon. Other features here, variable amounts of lymphoplasmacytic infiltrate, which may be particularly important in the more targeted therapy type of drugs. And then finally, with regard to time of onset, typically this begins fairly soon after beginning treatment with anti-CTLA-4 or anti-PD-1, but with the BRAF or MEK inhibitors, this can be quite variable. And in fact, in our patient was, I think, 8 to 12 months after initiation of treatment. In terms of response, these immunotherapy drugs can be treated with various alternatives, but for the BRAF inhibitors, there isn't a particularly effective treatment. So there you have it, the findings in a patient with anti-BRAF therapy and ischemic type colitis. Our final diagnosis is BRAF-MEK inhibitor-related colitis with the ischemic pattern, a serious reaction. And that kind of wraps it up. I think we will see more of those kinds of cases as time goes on and more patients receive these drugs and their uses are expanded to include more types of cancers that have this kind of pathway operating in them. So I hope you enjoyed that. And if you did, please hit that like button, maybe subscribe to our channel so you can catch future releases. And until next time, thanks so much for joining me.